In this section, we will discuss a relatively new group of anticoagulant drugs called direct oral anticoagulants. Unfractionated heparin was first anticoagulant that was clinically used. However, unfractionated heparin and all heparin-based anticoagulants can only be given in injectable form. So in search for oral anticoagulant, warfarin was first oral anticoagulant that was clinically used. However, warfarin has inter-individual variations and several drug interactions, so we need to adjust the dose of warfarin for an individual, and we need to regularly monitor anticoagulant effects of warfarin to have adequate therapeutic effects and to avoid bleeding complications. In contrast, this new group of anticoagulants called direct oral anticoagulants are small molecules and have adequate bioavailability after oral administration. And these drugs have predictable dose-dependent anticoagulant effects that are quite uniform among individuals, and we do not need to adjust the dose for an individual, and we do not need to regularly monitor anticoagulant effects of these drugs like in case of warfarin. Now let's see why these drugs are called direct anticoagulants. We know heparin-based anticoagulants potentiate effect of antithrombin 3. Antithrombin 3 is naturally occurring anticoagulant that is present in blood, and antithrombin 3 then inactivates clotting factors. So heparin-based anticoagulants are indirect anticoagulants, as these drugs do not directly bind to and inactivate clotting factors. Similarly, warfarin also affects synthesis of clotting factors, and warfarin also does not directly inactivate clotting factors. In contrast, direct anticoagulants directly bind to and inactivate a single clotting factor. So these drugs are called direct anticoagulants, as these drugs directly bind to and inactivate a clotting factor. There are two groups of direct oral anticoagulant drugs. One is thrombin inhibitors. These drugs bind to and inhibit thrombin. Only drug that is available for clinical use in this group is dabigatran. Second group of direct oral anticoagulants is factor 10 inhibitors. These drugs bind to and inactivate factor 10. When we see clotting cascade, we can see both extrinsic and intrinsic pathways can result in activation of factor 10. So factor 10 is first factor of common pathway that can be activated by both extrinsic and intrinsic pathways. Once factor 10 is activated, it can result in conversion of hundreds of prothrombin molecules to thrombin. Thrombin then converts fibrinogen to fibrin, and fibrin is required for formation and growth of blood clot. Thrombin not only converts fibrinogen to fibrin, it also activates upstream clotting factors that result in production of more thrombin. So we can see once factor 10 is activated, it results in significant amplification of clotting cascade that results in production of sufficient fibrin to maintain hemostasis. We can see factor 10 and thrombin have central role in clotting cascade, so most anticoagulant drugs including direct oral anticoagulants, heparin-based anticoagulants, and warfarin have effect on one or both of these clotting factors. So if a drug can inhibit factor 10, it will prevent conversion of prothrombin to thrombin. And thrombin then will not be available for conversion of fibrinogen to fibrin that is required for formation of blood clot. So if a drug can inhibit factor 10, it will prevent production of fibrin and it will contribute to anticoagulant effects of that drug. Similarly, if a drug can inhibit thrombin, it will block last step in clotting cascade before conversion of fibrinogen to fibrin and it will contribute to anticoagulant effects of that drug. And thrombin will also not be available for positive feedback activation of upstream clotting factors. So we have two groups of direct oral anticoagulant drugs. One group is thrombin inhibitors that bind to and inhibit thrombin. Second group is factor 10 inhibitors that bind to and inactivate factor 10. These drugs can be given in oral form and these drugs have predictable dose-dependent anticoagulant effect that is quite uniform among individuals, so routine adjustment of dose of these drugs for an individual is not required. And routine regular monitoring of anticoagulant effects of these drugs is also not required.